So our next speaker, Charmaine, is here. So Charmaine is our speech and language pathologist. She is experienced in the assessment and treatment of adult, adolescent, and pediatric communication disorders and adult dysphagia as well. Oh, there is Charmaine's pretty face. Charmaine has a lot of experience with working with individuals with mental and neurological disorders, learning difficulties, and acute illnesses. So today, Charmaine will be talking to us about stuttering and its impact. Right. Take it away.
Hey, hi, my name is Charmaine. I'm a speech and language therapist. And today I'll be speaking about stuttering, which is a type of speech disfluency, and its impact on people who stutter. Okay, so a little bit about me. I am fully registered with the Singapore Allied Health Professions Council, and I currently work with individuals of all ages, from young children all the way to the elderly, on issues with communication, voice, cognition, and swallowing. Okay, so today we will be talking about fluency disorders and specifically stuttering. And we will be covering what it is, some signs and symptoms. You might wonder what causes stuttering. And there are actually many facts and myths surrounding stuttering as well, which we will cover. And we will also talk about treatment throughout the lifespan and the impacts of stuttering, the impacts that stuttering has on individuals who stutter. And lastly, we will have a Q&A session where you can ask any of your questions regarding stuttering. Okay, so before you move on, if you just whip out your mobile phones, you will be able to scan this QR code. It will bring you to a web page where you would be able to enter any questions you may have. So as I go through this presentation, if you have any questions that pop up, you can actually just go straight into this page and enter it. We will collate those questions and we will address them in the question and answer segment at the end. Okay, so maybe I'll give you another like 5 seconds. Okay. Okay, so what is stuttering? Let's talk about it. Right. Stuttering is defined as a difference in the speech patterns that someone has that involves disruptions to their speech. It's known as disfluencies. And it can sound in like repeated words, repeated sounds or syllables, or just disruptions to the normal rate, such as speaking halfway and then there's a stop, or certain sounds are dragged. And this is often accompanied by a lot of physical tension and negative emotions. And a lot of people report like embarrassment, anxiety, and fear of speaking. Okay, so what are some signs and symptoms of clinical stuttering? So we are all not fluent 100% of the time. There are parts of speech that are considered normal disfluencies. However, people who stutter may have more and different types of disfluencies. So what is not considered stuttering is adding a sound or a word when you're talking. So if you're adding like, I need to go home, that kind of word adding, that's not considered stuttering. People who repeat whole words. So like if waiter asks you, what do you want to eat? And you say, oh, chicken and waffles. Yeah, that's not considered stuttering as well. Repeating phrases is also not considered stuttering. And changing words in a sentence is also quite normal. Not finishing a thought is also quite normal. However, clinical stuttering, you would see things like part word recognitions, sound repetitions, or one syllable word repetitions. So like you might hear someone say, go away, right? Or sound repetitions like whoa, want, coffee. Yeah, prolonged sounds. So sounds might be dragged. Or you might also hear blocks or stops. So someone who's like talking, and then suddenly like the sound doesn't want to come out and it continues. And so those are signs of stuttering. And it also has a diagnostic criteria on like how much of it. And so we have to see what type of it and how much of it is. Okay, so what else will a person with stuttering show? This thing called secondary behaviors. So these are behaviors that you might see that a person who stutters use to minimize the increasing severity of a stutter. And you might see things like avoidance of eye contact, a head nod when talking, a lot of eye blinking or squinting, muscle tension as well, and word substitution, so changing the words. Right? So these are some secondary behaviors that you may see in a person who stutters. Okay, so people who stutter may feel like they are very alone. However, stuttering is actually more common than you think. Right. So worldwide, more than 80 million people actually stutter, and approximately 5% of all children go through a period of stuttering that lasts 6 months or more. About 3/4 recover by late childhood, and that leaves about 1% with a long-term problem into adulthood. Stuttering actually is not culture specific, it occurs in all cultures. Okay, so what causes people to stutter? There's actually no single cause of stuttering that can be identified by research. However, we have been able to identify several contributing factors that can cause stuttering, such as family history. There is a genetic component in stuttering, and that can be seen from types of research, right, involving like twin studies or adoption studies. There are brain differences as well, and this is actually related to the way a child's brain develops speech and language. The emotions and environment that a child is in, if they have a lot of negative feelings related to speaking, this may increase tension and result in stuttering or prolonging of stuttering as well. And there is also acquired stuttering. So maybe it's a result of a brain injury or some severe psychological trauma. And thankfully, that is actually very rare. Okay, so let's go through some facts about stuttering. Stuttering typically develops between 2 to 6 years of age in a child. And a majority who actually begin stuttering at a young age will grow out of it. And for about 1% of the people who do, it will persist to adulthood. Stuttering is about 3 to 4 times more common in males than in females. And children who begin to stutter later, which is after about 3.5 years of age, are more likely to have a persistent stutter that lasts to adulthood. Okay, so the longer the child continues to stutter beyond a year, there is a greater risk that the child will continue to stutter all the way to adulthood. And one thing about stuttering is that it is very variable, meaning to say that it changes in severity within the day, within the same person, and also depending on what they're doing. So someone may stutter more in the morning or at night when they're very tired. Someone may stutter more when they're talking on a phone as compared to talking face-to-face with a person. So it really depends, and a lot of assessment and patient reports is required in order for us to understand an individual's experience with stuttering. Okay, and there are many myths surrounding stuttering as well, and we would like to dispel some of them today. One is that stuttering is not caused by children's parents, right? It is not because a parent is too strict or things like that. It is not the cause of stuttering. It is also not caused by pointing out a child's disfluencies, and the child is also not imitating a stuttering parent or relative. And I do hear this quite often when the parent says like, oh, my child began copying your uncle for fun, and now he's stuck with it with this kind of speech pattern. It is usually not because they are copying for fun and then they're stuck with it. It might be that they already have a predisposition, because as we know, there is a genetic component as well. And then that predisposition, and then they start talking like that also, and the child actually stutters. Okay, now stuttering is not a psychological problem, although it can have psychological effects, which we will cover later in the impacts section. Stuttering is also not a sign of brain injury, reduced intelligence, or reduced capability. Now, the only time stuttering is a brain injury, right, is if it's called neurogenic stutter and is a direct result of direct brain injury. Okay, that's the only time. But if a child is born with a stutter as they acquire language, and at age 2 to 6 it comes up, it is not because there is a brain injury. Okay, it is also not caused by learning another language, but it may present differently in bilinguals. So the way a monolingual person stutters might be a bit different from the way a bilingual person stutters. And it's not a reason to stop your child from learning another language. In fact, it's good to have children learn more languages at a younger age. And this is one of my favorites. Forcing a left-handed child to become right-handed also does not cause stuttering. Okay, so it's not, you don't need to feel guilty about that. It's usually a genetic predisposition. Okay, so all important question parents always want to know, can stuttering be cured? Well, actually, despite a lot of scientific breakthroughs in our knowledge about stuttering in the recent years, there is currently no reliable research-backed cure for stuttering. Currently, there's no drug, or there is no machine or anything like that, or even therapy. There is no standardized one-size-fits-all therapy that is going to cure stuttering, and it's not really given the variability of how stuttering comes about. It is unrealistic to expect that there will be one cure that we administer and stuttering will go away. So controlling stuttering is really a long-term project. However, there are things that can be done. Many people who stutter benefit from a lot of different forms of speech therapy and from support groups. They also, we have a lot of different methods. So we found that different methods work for different people. And realistically speaking, because there is no cure, stuttering does relapse from time to time. And it's very important also for people to realize that it happens, and it's not because you didn't work hard enough or things like that. Okay, and most importantly, long-term management will begin with acceptance. So accepting that, you have a stutter, accepting that your child has a stutter, and what we can move forward with. And with this acceptance actually requires a lot of patience and understanding of the person who stutters. Okay, so there's no cure, but can anything be done? Is there any help available? And the answer is yes. People who stutter can definitely learn to speak more easily. They can also gain confidence in their speaking ability, and they can also communicate effectively. There are various treatment options for people who stutter. And because stuttering actually typically starts between the ages of 2 or 6, early intervention is the most effective way. It is very beneficial to help children overcome their speaking difficulties. However, school-age children, adolescents, and adults can also benefit from treatment despite having stuttered for a longer time. For these individuals, treatment is designed to actually help them manage their stuttering, so it is less disruptive to their communication, to increase their speech fluency, and for them to gain more confidence and have better self-esteem. Okay, so we're going to go through some treatment methods. Okay, in young children, now stuttering frequently begins, and there is a research paper that said most commonly it begins between the ages of 2 and 3.5 years. And because of that, it is mostly indirect because we work a lot with parents, with family members. We are working to decrease stress in the family environment, and we are trying to increase fluency in their speech or increase the fluent behavior. And why stuttering often happens or starts at that age, it actually is because it emerges from a lot of competing skills. However, a very limited kind of cognitive capacity. So at that age, a lot of things are happening with them. They are learning verbal skills, they're learning language skills, they're having a lot of other motor skills. So there is a great amount of growth that a child goes through, and yet the cognitive capacities are limited. So there's a lot of things competing for a limited pool of resources, right? And so stuttering emerges from an interplay between a child's disposition, so how their emotional coping is like, right? Stresses in their environment. So a child who's undergoing a lot of stress may not cope with changes that well. There is a lot of competition for cognitive and brain resources, and also because all the other capacities are developing at the same time. Now, indirect treatment is preferred at this age because young children are barely aware of their dysfluencies at this age. right? Because they don't really know that they're stuttering. Even if they do notice that they stutter, their awareness kind of comes and goes as well. So their stutters tend to lack tension. And they don't really have a lot of secondary behaviors, also known as escape or avoidance behaviors, because they are not really aware of their speech all the time. So because they do recover spontaneously, our aim in treatment is really to prevent stuttering from becoming more severe and to maximize the likelihood that the recovery, spontaneous recovery, will take place before the factors that influence persistence take root in the children's lives. So what is also helpful for the parents to learn the ways that they can facilitate their child's fluency, because it gives them a lot of control and confidence in their abilities to effect long-term change. So working with family members, very important. Okay. And the treatment goals often focus on facilitating fluency. And these are already some things that you can do at home, right? We want to speak very slowly with pauses. And we don't want to ask so many questions, because every time we ask questions, child gets stressed. And maybe they don't know the answers, then they won't say anything, or like they get stressed and then the stutter becomes worse, right? So we want to speak slowly with pauses. We want to change our questions into comments, and we want to listen very attentively to the child with a lot of patience. Right. Treatment will also focus on reducing parents' anxiety about your child stuttering, because the more anxious the parents are, the child actually picks up on that, and then they will also learn to become anxious over the stuttering. So when we manage a parent's anxiety about the child stuttering, we also are likely to reduce the possibility that the distress over this stuttering speech will be conveyed to the child, right? And reducing the child's alarm at their own stuttering, because sometimes the child stutters and then they become very anxious because they don't know what's happening, right? They are trying to say a word, but when my mouth is not doing what I want my mouth to do, right? So we want to reduce their own alarm. And in this way, parents can also comment acceptingly. If the child seems very frustrated when stuttering occurs, parents can give some assuring comments. They can also help the child out with their communication, so it reduces the alarm and the emotions that are stirred up by the stutter. And another thing we will advise parents to do is reduce general stresses in the child's life as well. Okay. We have direct methods as well in order to work with children who stutter. There is the LITCOM program, which is also a kind of conditioning program that the children go through. And we also, this program has a large component on parent education as well. There is also the Restart Demands and Capacities model. And we also want to treat any other associated speech and language problems. So sometimes children who stutter may also have a speech delay, or they may also have language delay. All these things we would want to treat as well, just to maximize the success that they have with their communication. Okay. In older children, it is a little bit different, because when children are older at school age, they actually have a lot more awareness, and more emphasis is placed on identifying their own feelings and attitudes towards their own speech, right? So what we can do is we listen acceptingly to what the child says about the speech. So if like they're telling you that they've had a bad experience, or they have certain thoughts and feelings about themselves, instead of dismissing their feelings, we want to listen very acceptingly. We want to join the child or student in playing with stuttering. And the function of this is really to reduce the anxiety that they have around their stutter. And by doing so, they are able to reduce the tension and struggle that's involved with trying to get words out with their speech. We also need to desensitize the student to difficult situations and challenging words. We want them to fully participate in speaking situations. So desensitization, what we can do then is actually to help the child continue participating, because they're still very young and we don't want them to start to avoid situations or avoid words. So the desensitizing will help. Okay, what else can we do? The focus is actually on working with parents and teachers, we want to create very stuttering friendly environments. And sometimes if it helps the child, what this looks like is like presenting, maybe having a class project where they present to the class about stuttering. And then the classmates will understand, okay, this is actually what kind of speech situation is this? What the friends, what the teachers can do in order to facilitate the child's communication. So these are things that we can also do. We also want to teach students very specific fluency skills, and there are many methods, as I've mentioned. We just need to find the ones that actually work for each individual person. So we can also teach them specific fluency skills to make them speak a bit more fluently. And in adolescents and adults, this also looks different from treatment of children, because adults and adolescents would be considered what we call advanced stutterers, because they have lived their childhood and they've lived for a long time with a stutter. So sometimes they feel differently and they may have different kind of speech behaviors as well, because they would have learned to stutter with a lot of tension. They may have a lot of speeding up responses, and they may stutter, or they may have these behaviors, the behavior responses, whether they actually stutter or not. So sometimes they think that they're going to stutter and then they start tensing up or they start speaking differently. Right. So these are behaviors that we want to target for therapy. We need to be very transparent with these people about their fluency goals, because we have to, first and foremost, we have to let them know. Sometimes people come in expecting a cure, like they want to know if there is like any supplements I can eat, or if there is a program I can buy online, and if I just practice, I can speak as effortlessly as you. Some of them ask me that. And we do need to discuss what their goals are for fluency and the expectations for treatment in order to have a goal that we can both work on together. And we also need to explore their feelings and attitudes towards their speech, because they need to understand what stuttering is, and they need to understand, there is nothing to feel guilty about. Just because you stutter doesn't mean that you can't achieve the things that you want in life. So we have to work through all these feelings as well. And then also we would have to talk about how their newfound fluent speech. So sometimes we work on a lot of speech restructuring techniques. Then how do we generalize it to different areas? So we don't want to just be fluent in the therapy room. We want to be fluent outside also when we are talking, like giving a presentation, for example, or we are attending an interview. How do we generalize these new speech patterns to different contexts? So we do also need to address any psychological impact that stuttering may have on these individuals as well. Okay, and so we have direct approaches also for individuals when they reach adolescence and adulthood. And that looks like the Camper Down program. So Camper Down program can come in a very intensive form. So like 3-4 days, back to back non-stop, and you will emerge with more fluent speech. And then we will work on how to generalize that kind of fluent speech to different areas. There are also different kinds of fluency shaping techniques. So again, very, very tailored. It's always tailored to the individual. We need to know what works for you, what is realistic for you, then how do we keep it going, right? And we also recommend a lot of treatment and support groups for them. So treatment and support groups are helpful because sometimes as a person who stutters, and then you're seeking treatment from a therapist who perhaps doesn't stutter, there may be certain things that you feel that, a fluent person is not going to understand. That's where the treatment and support groups actually come in, where they are able to share a lot of tips with each other through lived experiences. So that can really be very helpful. Okay, so we've spoken a lot about stuttering and what it is, but why is it important to many people who stutter to seek help? So we want to talk about the impact of stuttering and why we want to treat stuttering. Okay, so bullying is a really big one, I think, especially in the younger ages. Everyone is worried about that. And research has actually shown that children who stutter are at a higher risk of bullying, especially from the preschool to adolescent age. Okay. And we also know that youth who stutter are likely to experience negative reactions from others because of their speech. And this also results in them having a lot of negative attitudes towards themselves and their speech because they experience so many negative reactions from others. Okay, so also in a survey of 267 adults done in 1999, actually 83% of these adults report that they were bullied in school. So there is a association, with the way that they speak, with the way that they are treated by others. Then their experiences with their peers, with other people are quite negative. That results in a lot of negative feelings towards themselves as well. Okay, and because of all these negative feelings that they have about themselves, a lot of them report that their mental well-being is very affected. Most commonly, they report anxiety and poor self-esteem. It's more frequent in children who stutter. And individuals also report a lot of negative feelings of helplessness, shame, and fear of judgment and reaction. And this actually might result in avoidance to hide their stuttering. So this might mean avoidance of people, might mean avoidance of relationships, it might mean avoidance of situations, opportunities. So that will actually lead to reduced quality of life. So a lot of people who stutter report that their vitality is affected. Right, vitality is also known as energy levels. So a lot of them report that they are more fatigued in general every day. They also report that stuttering has had a negative impact in their participation in social activities. And you can imagine a person who stutters might feel a lot of social anxiety because of the way that they have been treated, perhaps in school, because of their speech. And so they don't participate as much. And that has a direct impact on them. It also affects their emotional functioning. So they may find that they don't cope as well with feelings and emotions because they've just had so much negative feedback. And all this will result in a decline in their mental health. And some people actually believe that the ability to fulfill their life ambitions has been limited. So that's actually very sad for them. And one of the important things that the adolescent population is very worried about is about how stuttering would affect their employment. So in a study of 232 adults who stutter, a very large percentage, 70%, felt that stuttering affected their chances of being hired or promoted. More than 30% believed that their job performance was affected because of their speech, because of stuttering. And 20% turned down a job or promotion because they stuttered. Large percentage of them reported casual discrimination at work because of their stutter and the way they speak. And a lot of them report that they do settle for jobs with less communication demands. So perhaps they are able to achieve more in their jobs. They feel that way, but they do choose to settle for a job or a role that doesn't require them to, for example, answer the phone as much, or doesn't require them to meet a lot of people if they have issues with self-introductions. Okay, so we have gone through some of those negative impacts, right, the stuttering has had on people, but it's not all doom and gloom. There are some positive impacts. Research has also shown that people who stutter bring many particular strengths to the table. For example, they have a great empathy and compassion for others. A lot of them report that they have a lot of personal growth because of their stuttering. They have a lot of resilience, right? Strength of character because of all the lived experiences that they have had as a person who stutter. And they also become more creative. I think it's just ways that they can cope with their stuttering. They are also stronger, right? And they have better social intuition. So there was more than one study actually that identifies this skill known as listening intelligence. So there is a strength in this area, which is the ability to pick up very subtle information in conversations. And a lot of respondents in a 2014 study also reports a variety of strengths associated with their stuttering. and also a number of ways that their stuttering had a positive impact on the people around them, on other people, right? So it's not all doom and gloom. And coming to the end of the presentation, I would like to end off by saying that stuttering actually affects people of all ages and all walks of life, right? While people who stutter have many, many challenges to overcome, I just want to stress that stuttering is not a measure of one's capability. So if you see over here, and then I'll just finish up the slides here. Right, so you see many people, everybody here stutters on this slide, right? And many people who stutter continue to be individuals that we admire and look up to. And they are very well known. So there are well-known people who stutter, and these include like actors, politicians, philosophers, and they are respected leaders of their field. So for example, much of the stuttering research that we have today actually comes from speech therapists and clinicians who stutter themselves, such as Van Riper and Barry Guitar. And so they are leaders in their own field, right? So it is my hope that people who stutter will look at all these individuals and realize that they are not alone and they have a lot to offer and they are not limited by their stutter. Okay, so I've come to the end of my presentation. I'll be taking questions. So yeah. Okay, so how do I know if I need help? Okay, let's address that. So sometimes if you feel like your speech is not fluent, or if you have any concerns about your speech, you could speak to a speech therapist. You can come for an assessment and we will be able to tell you, whether what are the issues with your speech or address any questions that you may have. With regards to whether you need help, actually, something about therapy is that if you think you don't need help, right? If you think you're okay, then usually you don't need help, right? It's not a problem until you think it's a problem yourself. So there are one thing that I would like to say is stuttering severity. Severity is actually not tied in with how anxious a person is. So there are people who have a very, very mild stutter, barely noticeable, but they are very, very anxious about it. And then I would say, yeah, you probably want to talk to someone about it and see what we can do. There are also people who have more severe stutters where they are very disfluent, but they don't really mind. And in that case, that person might not need therapy because they don't mind that they stutter, right? So it's really, if it impacts your life, if it impacts you in things that you want to do, then I would say perhaps you would want to come and speak to someone and seek help. Okay, is stuttering when nervous normal? Yes, so because a fluent speaker, when they are nervous, they do have more disfluencies. Sometimes the assumption is that stuttering is because people are nervous, right? Or stuttering as a medical condition is because it is out of nervousness. It can make stuttering worse, but it doesn't cause a stutter, right? It doesn't cause a person to be labeled or be diagnosed with stuttering because they stutter when they are nervous. So if you become very disfluent when you are nervous to the point that you cannot get your message across, then perhaps you might want to also seek the advice of a speech therapist to see what kind of stuttering it is. So remember, there are typical disfluencies in a fluent speaker speech, and then there's also the stuttering disfluencies. So it depends on also what type it is. Okay, so but directly to answer your question, it is normal to become more disfluent when you are nervous. Okay, so how do I know if my child has a stuttering problem or if I can just wait it out? So that's a really good question. If your child is not fluent, basically you hear a lot of repetition and things like that. Like I said, because it's common, right? 5% of all children actually stutter between the ages of 2 and 6. However, if your child has been stuttering for more than 6 months, you would probably want to get it checked out already, because sometimes they outgrow it. But I wouldn't wait more than 6 months. If it's beyond 6 months, then there is a risk that it is going to persist to adulthood. So we might want to kind of assess the child to see what kind of factors are causing the stutter to prolong and what we can do to actually shape the environment to encourage fluency. Yeah, so sometimes it's really just about, addressing parental concerns or small tweaks that we can do in the environment to help the child become more fluent. So 6 months, 6 months would be the cutoff where I would say go and seek some help. Okay. So where can I sign up for the programs such as Camperdown, fluency shaping and treatment and support groups? So before you are assigned to the program, I think it would be good to seek an assessment from a speech therapist. So the speech therapist would be able to discuss with you and let you know what your options are, because stuttering is so varied and is so tailored to every individual. It depends on a lot of feelings and attitudes towards the speech, the actual speech itself, right? And then also your life schedule, your life responsibilities, your goals, what you want to do. So all these things actually influence what kind of therapy you're going to have. So you want to have an assessment first with a speech therapist and to discuss all your treatment options. Then after that, the speech therapist would be able to recommend a program for you. So where you can sign up would be a speech therapy clinic. We also do it here in AKIDS. We also do it at the Voice, Speech and Swallow Clinic, which is our adult branch. Treatment and support groups, you can find them online. So the biggest one would probably be the UK and US ones. Okay, does AKIDS allow job shadowing opportunities? Okay, let's not talk about that one. Let's address the parents' report that their children stutter when they're trying to think of what to say. How do I determine if it's a true stutter or word finding difficulty? So sometimes we go back to looking at that, whether it's a typical disfluency or a stuttering disfluency, right? So if let's say they are stuttering because they sometimes we get bilingual kids who stutter in their poorer language, right? Their second language more. And that is actually very normal because that might be a proficiency issue rather than a motor speech stuttering issue, right? Yeah, so if they are stuttering in a way that is in the column of the stuttering kind of behavior, such as the prolongations of the word, so like they drag out the sounds, if they are repeating like part of the sound, so like I want this, yeah. So that those kind of stutters, then you would need to see first what they are referring to. So that would be proficiency is one thing. So you would need to rule out like a language disorder or a knowledge problem, so to speak, right? In order to diagnose a stutter. Okay. Where should I seek for speech therapists? Any recommendation? Well, here we have speech therapy services here in Annabelle Kids and also in the adult branch, the Voice, Speech and Swallow Clinic. Yeah, so we do also have programs for stuttering. We have programs across the lifespan for children, such as LitCom program. We have the demands capacities where we have people advise parents on how to shape the environment in order to facilitate fluency. And we also have a Camperdown program here where we work with adolescents and adults. And also some individuals come to us with a lot of anxiety, or they need to address, many negative feelings about themselves with regards to their speech, and they may also benefit from psychotherapy services. So we do have this as well. So it really depends. But if you are concerned about your speech, if you're concerned about your child's speech, if your child has stuttered for more than 6 months, it would be good to speak to a professional about it. Okay, I think that's all we have for today. So thank you for listening, and I'll see you soon.